Good morning, everyone, from wherever you are located. Today we have people from all over, particularly from Nairobi, Rio, and New York. It's great to have you join us today. Columbia Global Centers Rio and Columbia Global Centers Nairobi welcomes you to our webinar this evening, which is titled COVID-19 and Mental Health in Informal Settlements. How bad is it and what can be done? Columbia Global Centers are a group of centers positioned strategically around the world at Columbia University. The centers facilitate collaborations between Columbia University, academic community with local partners to engage in research and education activities, which also include serving as a platform for knowledge sharing and finding solutions to our everyday problems. This session will be recorded. The video will be posted on our YouTube page and our website. As we proceed, you can post your questions in the Q&A section. You will find this button at the bottom of the Zoom application window. To charge you up, we would like to request you to anticipate our webinar next week, the third one in this series, titled Stigma and Discrimination in the Midst of a Pandemic, What's Happening in Informal Settlements. You don't want to miss out. Please mark your calendars for Monday, June 15th, 5 p.m. East African time, 10 a.m. New York time, 11 a.m. Brazil time. I would now like to hand over to our moderator today, Professor Yamile Martí, who is a lecturer at Columbia University's School of Social Work. Welcome, Professor Martí.
Welcome, and good morning, and good afternoon, and good evening, depending on where people are. So we are here today to talk about mental health, which is a global matter that affects us all, and it manifests in very different ways based on culture, environment, context, social, and political context. But we know that it has been exacerbated by the global pandemic that we're suffering. So today we will just want to learn about mental health and COVID-19 in informal settlements, as Pauline said, in Kenya and Brazil, and how is it manifesting and how are people being treated or helped. Our panel, our distinguished panel, consists of Dr. Julia Kagunda. Dr. Kagunda is the founder and director of Elim Trust, an organization that works with community and religious leaders to promote holistic wellness for communities. She focuses on community-based interventions with emphasis on building capacity of community leaders who have been instrumental in addressing psychological issues in their communities, particularly sexual and gender-based violence, and their links to mental health. We have Milkah Gakuru. Milkah Gakuru is local human rights activist and community mobilizer who is a resident in Mathare informal settlement. She does mental health advocacy. She has teamed up with a number of women in Mathare to perform rescue for victims of gender-based violence and coordinating medical transfers for those in urgent medical need. We also have Dr. Flavia Pitella, psychologist at Terapia para Todos. I said that in Spanish, I know it's in Portuguese. And Dr. Flavia Pitella is a psychoanalyst, clinical psychologist, and university professor. She has extensive performance in the human resources area as a coordinator and human resources manager of multinational corporations. For her, psychotherapy is a matter of primary demand for audiences in all areas and classes of society, and she believes that mental health is everyone's right and should be accessible to all. I'm sure we're going to have a very fruitful conversation today. We unfortunately want to apologize on behalf of Dr. Vanessa de Sousa, which was advertised as our fourth panelist, because she had an emergency and cannot attend today. So why don't we just start and begin by creating a shared understanding of the context of each city and or country, Nairobi and then Rio. And I would like for our panelists to please introduce the state of mental health and how does mental health manifest in your particular community. Dr. Julia Kagunda, could we start with you? I think maybe, Dr. Kagunda, could we start with you?
I can jump right in to talk about the state of mental health, especially developing countries and in Kenya. And as we think about COVID-19 and we think about Africa and specifically in the informal sector, a number of issues come to play, starting with the fact that even before COVID-19, mental health is one of those issues that have really been stigmatized. We are living in a context where, especially in the informal sectors, that mental health is not understood at all. And there is a blanket way that mental health has been blanketed under the name madness. You use that word. And because of that, we see that people, one, they don't want to go for mental health, they don't want to go for medication. As much as there are no facilities, not aware about different types of mental illnesses. COVID-19 has even complicated it so much because there are many mental health challenges that have come, especially in the formal sector. COVID-19 is still going up in the African countries, not as gone up as it was initially projected. Mental health in this context is mainly economic hardships, because with COVID-19, which comes with lockdown, people have had to stay at home, especially in the informal sectors where people mainly depend on casual jobs and all that. Without that, it means they have no form of source of income. Because of that, we have seen there are very many challenges, like gender-based violence has gone up, depression has gone up, and this is signified by a number of things like suicide rate that has gone up. We had a case recently where a son killed his mom because she did not give food in the evening. So suicide and killing of people has really gone up. The crime rate has gone up, but it's becoming a complex issue, so to speak, because people are caught up in this setup where there are so many issues. And as much as there are many issues, mental health is least prioritized. And because it's least prioritized, people are not even seeking for services. And even if they are to seek for services, those services are not there, with very few psychologists and with very few mental health service providers.
Thank you, Dr. Julia. Milkah, could you share with us the state of mental health in your community?
Yeah, hi everyone.
Hi.
Nice to see you again. Yeah, concerning the COVID-19 pandemic, in informal settlement, it has brought about this loss of job due to the fact that most people in informal settlement depend on a hand-to-mouth daily food. It has become a great challenge as the job they were dependent on is normal. Some of those who were lucky to be employed somehow in the different areas has also been sent off from job without any payment per se, and hence this has created more and more job loss. Crime. Since the beginning of this pandemic and the loss of jobs experienced in the informal settlement, crime has so far been increasing. This is because many people are idle, are lost their jobs, that is. Being the issue, especially among the youth, crime has been rampant and is affecting the community at large. Amongst the children and the school-going teenagers has been so challenging them to cope up with the situation, as no one was mentally prepared about the situation, as no one was, yeah, exactly. This is created to bring about our school-going children in the informal settlement at to engage in behavior such as drug abuse, sexual practices, alongside the practices and in our children, and being that the informal area parents are juggling and struggling hard to either put food on table or look after their children. And given the fact that there was no prior plan to deal with the issue amongst our school-going children and teenagers, it has greatly affected the informal settlement at most. Household violence. The COVID-19 pandemic has greatly bring about more rising household violence. This is because most of partners were not used to each other, spending much more time together, and hence because of job loss, it has not been easy. That is, Milkah, I have received a lot of cases concerning husband to wife violence and vice versa. In accordance to the small business that we are massively growing in the informal settlement, this includes the roadside kiosk, green groceries, boutiques, and selling of shoes alike or clothes. It has been greatly affected, and many of small businesses has closed down. Due to these reasons, loss of job, increased crime, household violence, problems in mental health, physically health, and most people living in the informal settlements are stressed due to these, hence causing people to commit suicide. Can I go on? What can be done? Can I give?
We're gonna go to that question in a little bit. Why don't we go to Dr. Flavia and then come back to what we can do to help cope with the mental health crisis. Is that okay, Milkah? Yeah.
Thank you for the chance. These are good chance to me. Thank you. God bless you.
Thank you. Dr. Flavia, would you tell a little bit about how mental health is in Brazil and especially in informal settlements?
Good morning, everyone. Good evening and good afternoon for all those that are from everywhere around the world. Well, about Brazil, I'm going to start talking about numbers because I think this is something in particular that Brazil is achieving something extremely dangerous, and the government is doing nothing about it. And I think with numbers, maybe we can work a little bit more, because mental health still goes on, but favelas in Brazil, they don't have so much freedom and access to mental health. So for the IBGE, that is the institute that makes all the statistics in Brazil, they did a census in 2010, and at that time we had almost 11.4 million people living in favelas. That means 6% of all our population here in Brazil. So we have 6,329 favelas in 323 cities in all country. Although we have 5,565 cities in Brazil. So we have more favelas than cities. This is absurd. So per year, the favelas consume from all commerce, from all benefits, from everything. They work around 100 19.8 billion of reais per year. So that is a lot of money going on inside the favelas, and for people that doesn't have the minimum to live, like they don't have water, they don't have like conditions for not only for mental health, but health in general. Although we have in our constitution of Brazil that says that for all Brazilians we have the right to have health in general, physical, biological, and mental health. So we all have the right to have health in Brazil, although this is in our constitution. We don't have it in making it practically. So it's worse to think that nowadays we have 1.3 million people living in favelas, and in Rio we have 6.3 million people living in favelas. So this means 22% of the inhabitants. So it's a lot. It's one quarter of our population are living in favelas. They are workers, they are mothers, they are fathers, children, all kind of people. So this is important to say, because people, when they think about favelas, they think about all the thieves and like smugglers and stuff like that, and that's not the real stuff. The reality is that our population, they are living in favelas. They are the ones that need the most. They are the ones that spend the most amount of money inside our state, and they should have more attention to their health in general, medical health and also mental health. So in May 21, it has, I looked up some numbers so you can understand more about what COVID-19 is doing here in Brazil, especially in favelas. In May 21, favelas in Rio have more deaths than in 50 Brazilian states. And this increase had taken 8 times in 1 month, just 1 month, 8 times. In May 29, almost 1,000 cases were confirmed in the Brazilian favelas, especially in Rio. This 1,000, I'm talking about Rio. And it's important to say that it's very sad, the number that I'm going to say at last, that 75% of favela inhabitants do not look for medical help. So that means that they don't look for medical help, so they don't look of mental health either. And as we know, in favelas, we have CAPSs. CAPSs is like these little clinics that have psychiatrics, psychologists, and all kinds of areas to help the favelas. And inside one CAP, we only have one psychologist for all the community. This means that these people nowadays, in times of COVID-19, they are not having mental health taken care of. So it's dangerous to know what's going to happen until this goes on, because we don't know what's going to be tomorrow or what's going to be next month. These people are afraid. They are afraid to get the COVID-19, but they are also afraid to what's going to happen to them because of they are not working. they don't have places to work. So they normally do informal jobs. And these people need this money. They need these informal jobs to get like food, like little stuff to their houses. Also to hygienic or cleaning up stuff inside their houses, and also to get all cleaned and everything to get in-house and don't contamine all the people that live in one house. Normally in one house, you can say that one house with one bedroom and a little sitting room can live 7 people in each house. So that is a lot. That is very dangerous. And for mental health, living like that, like one, like it's almost saying that is one above the other inside one house. So it's crazy to think about that. And to think that those people, they don't have mental help helping them is more dangerous than anything, because it's not the illness, but it's also the problem of the economics, that they don't have money for all the stuff.
Thank you, Dr. Pitella. So I wanted to just take a pause and invite our audience to use the Q&A button in your screen to ask questions for our panelists. We'll have a Q&A session in the last 10 to 15 minutes of our time. So please feel free to put any comments or any questions you would want us to share with the panelists. And also just want to say that this is a team effort. So I want to say thank you to David and Lena Obara for joining us and helping us potentially with any translation or any technical issues. So continuing with this conversation and asking Milkah, could you tell us a little bit about how mental health is showing in with COVID-19? Are you seeing depression, anxiety, issues of trauma, for example, grief and loss? I know in many countries being able to mourn the people who have died, it's impossible because it's highly contagious to go to a funeral. And that creates a lot of anxiety for the family of not saying goodbye to their loved ones. So can you tell us a little bit about how it's manifesting in COVID-19? Milkah, we'll start with you.
Okay, thank you again. Lena, are you there? I need your help. I will speak using Swahili. Just bear with me. Lena, are you there?
Yes, I am.
Okay, thank you. Nilikuwa nataka kuelezea vile hiyo actually vile watu wamekuwa also me affected mentally. Like I have niko na scenario ya jana, naweza nikatumia ya jana. Poverty may lead so many people who are affected, because I remember mwanamke yule ambaye nilikuwa namzalisha jana, not because angetaka kuzalia kwa nyumba, but actually kwa ile hali ambayo tuko ndani, yeye na mume wake hawaendi kazini. So yeye alijivumilia tu kwa nyumba, na ikafika wakati whereby niliintervene, nikaitwa. So nilipokuwa nikimsaidia, hakujifungua jinsi inavyofaa kujifungua. Mtoto alitangulia na miguu, alitoka na miguu. So you can see how hii hali ime affect so many people that hangetaka hiyo hali ikue, but actually because they had nothing, lazima ingekuwa tu hivyo. But we are praying Mungu amsaidie mtoto apate kukua sawa, otherwise the life haikuwa poa sana jana. Maisha yake ilikuwa kwenye hatari. Actually sijapata the report. And translate fast hiyo. No.
Okay.
Yes.
Milkah is trying to say that poverty has increased during this COVID-19 season. She gives a clear example of what they had to go through yesterday. In her neighborhood in Mathare, there's a woman who was expectant and she had to give birth from home. So Milkah was one of the women who had to help her. And she says that due to COVID-19, the lady lost her job, so did the husband. And so they had no any other option, no way to get to the hospital and to get better care. So in the process of helping her deliver, the feet came out first instead of the head, and there was a big medical complication as a result of that. I think they tried to get the woman out to receive some assistance, but she has not yet gotten a confirmation on if they're fine, if the lady and the child are fine, but that she hopes for the best.
Yeah. Also, I have another scenario today. Nilikuwa wakati si tumepata shida na mmoja wetu ni mgonjwa, I mobilize. Mufanya mobilization, tuna contribute. But now leo maisha ilikuwa ngumu sana because hakuna mtu anaenda job. Na yule madama alikuwa amefura tumbo, alikuwa ameswell miguu, na ilikuwa ni emergency na lazima angeenda. So to me kwangu kwanza niko affected tu sana because singeangalia huyu mwanamke afie kwa nyumba. I had to kuingia kwa mfuko yangu whereby a little I had, na ikanibidi tu ni mtume Kenyatta. But you see now, wale watoto ambao wamebaki kwa nyumba ni wadogo sana, they are young. So hatujui kutaenda namna gani. The mother is serious na watoto wamebaki kule, so see how they will be affected. I'm also affected. Actually the mother was very serious, hakuwa hali nzuri kabisa hata sijui I don't know. Today sitasema sitaweza akilisha, but actually leo niko affected, si feel vizuri. The whole of last week and this week now, see vile kungangana, but unaona kabisa unafika kwa ukuta, you have nothing in your pocket, haujui saidie namna gani. Also wale ambao nimewacha huko nyumbani, I can imagine how I feel now, vile wale wengine wako kule vile wana feel. Actually the situation, hakuna mtu alikuwa prepared. The situation imemess our minds kabisa. Mentally we are messed, that is. Yeah.
She gives another example of what they did today within the community that she lives in. They had a medical emergency. So prior to COVID-19, they were in a position to come together and pool their resources, help fund someone who's ill to be able to be taken to the hospital. So today they woke up to a case of a lady who had a swollen stomach and swollen feet. They didn't know what it was, but she must have been in that condition for a long time. So Milkah does mobilization within the community. So they had to come together with other women and pull together the little money that they had out of their pockets to be able to transport this lady to the National Hospital in Nairobi so that she could get help. So what she's saying is that this has affected them mentally. The people around the place where the woman live are affected, the children are affected. So this has become hard on them.
Thank you, Lena, and thank you, Milkah. Dr. Julia, could you tell us a little bit about what you're seeing also around mental health and how is it manifesting in terms of maybe the typical conditions that we talk about, depression or anxiety, and how does it show?
One of the way it is showing, just to echo what Milkah was saying, is that the support system, Kenya, informal sector, people tend to be very communal, where they come together, the crisis, and they work together. But the thing about COVID-19, because of the social distancing that comes with it, you find that the support system that is there in the community is no longer there. So that in terms of a crisis, your neighbor, your church, your women in groups, which we call chamas, are not there to help us. So in terms of loss and grief, it becomes even double tragedy because it becomes double tragedy because, for one, you have lost a loved one, or a loved one is sick, but then you have no support system. And because of that, we are seeing the level of depression going very high, and panic attacks and all that kind of thing because of these different scenarios that are there. The other thing is that there is also increased child abuse, because you realize in the informal sector, there is parents, they are not working, children are not going to school, and sometimes they don't have food. And the whole issue of projection from the counseling point of view, it's one of the other things that is really manifested. And so as a result, there is high level of children abuse who are just at home, not going to school, especially in the informal sector. In these other sectors, maybe there is online schooling and all that, but in the informal sector is not there. Children are there, and parents almost don't know what to do with them. And because of that, you realize that even children, we are seeing an increase of mental health related issues that are affecting children. When it comes to youth, again, who are caught up in this COVID thing, they can't go to work, like we said earlier, we are seeing high level increase of alcoholism and substance abuse. And again, that comes with all whole of mental health related issues. So you realize that everyone in the community is affected by COVID, because of there is no support system. There are all these structures that are not, which were there before to support people, but are not there. Some of the NGOs which used to go to the informal sector to help people in different ways, they are no longer going there. So it's like the escalation of issues from one level to another, which is affecting mental health when it comes to depression and everything. Unfortunately, again, mental health is not prioritized in Kenya, in Africa as a whole, is not prioritized. So nobody will think about, even the government itself, to come and intervene in terms of mental health. Mental health services are also very limited. So we have very few counselors, we have very few psychiatrists, and so it becomes, a number of issues that are coming and not being addressed. And as a result, there is increase of all these mental health related issues like depression, which is also, like we said earlier, we are seeing high level of suicide that is taking place.
Thank you, Dr. Julia. Dr. Pitella, could you tell us a little bit about the situation in Brazil as well, in terms of how it's manifesting?
Sure. Here in Brazil, like in the favelas, we have like a program that it began with two favelas specifically, is Babilônia and Chapéu Mangueira. And those two, they started asking for, in the internet, on the websites and Facebook and all that, asking for psychologists that were available to be voluntarily work in those favelas to help the inhabitants of those favelas. And what we saw, it is that many of people that lives in favelas, they have they are not only afraid to get in touch with COVID-19, but also they are having more and more anxieties. So the anxieties are getting to the turn of anxiety in general. So these people, they are not going to work. They can't, at this moment, they can't work. They can't send their children to schools. As Dr. Julia said, the same happens here in Rio, here in Brazil. So these people are staying at home without money, without food, without hygienic, without anything, and they are getting very anxious. So it's important to say that almost everyone like me that do not live in a favela, I'm also anxious. Imagine if I don't have money or food inside my house, and I know that if I go out, I can get COVID-19. This is very, very, very strong here in Rio, and I can say in Brazil in general. And to say for last is that there are also ONGs and people. They are getting people that have a little bit better conditions. They are sending water. They are sending food to the favelas to help these people. But this doesn't mean that the government shouldn't do the same, shouldn't do something to help these people, because mental health we cannot send in a box to these people. Mental health, we can do it doing like proper stuff. We're doing proper government statements so everyone can prioritize their mental health at this moment. And this is not being done. So all the things that the favelas have is only volunteers doing stuff for them and not the government. This is very sad and this is very dangerous.
Thank you so much. I think I'm gonna ask a question based on the feedback that you just gave us at the explanations, which is especially to you, Milkah, your reaction when you were telling your story. You're part of the community and you were helping that woman. Could you, each of you, tell us briefly how are professionals and or social workers or community leaders like yourself, Milkah, managing the mental health effects on you and the people who are doing the work? Because we are talking about the communities, but we also are all, as Dr. Pitella mentioned, affected by the anxiety of COVID and being at home and working from home. So is there any help for the people who are helping? Is there any supports for the people who are doing the work? Milkah, could we start with you? You're muted. Thank you.
No, actually, to me, there's no help out there.
You're muted, Milkah. There we go.
You can hear me?
Yes.
Okay. Come again.
Could you share if you're in your communities, is there any support for the people who are working like yourself with people who are affected by COVID-19 and the impact of COVID-19? And if you feel that the workers like yourself and the leaders of the community like yourself are suffering from vicarious trauma or from the same anxiety and problems that the community is going through?
Okay, actually, right now, since the situation is not good and people aren't going to work, when I come along, all the report, I get any report, like to, Lena, can you come please?
Yeah.
I want to make it clear for you people to understand. Okay?
Nirudie swali kidogo ama umeelewa vizuri?
Ebu rudia. Anataka kujua whether kuna
anaongelea juu ya afya yako ya kiakili. Wewe na wenzako, community mobilizers wenzako, social workers wenzako, ama kama kuna mtu mwingine mwenye anashughulikia mambo ya afya. Unaona kama nyinyi wenye mnafanya hiyo kazi, kuna usaidizi wowote ambao mnapata kwanza kwa huu wakati wa COVID?
No. Tunang'eng'ana sisi wenyewe kwa wenyewe.
Sasa mnasaidiana? Okay. What Milkah is saying is that there's basically no debriefing before they go into these scenarios. There's no person who comes in, no special organization that addresses these kinds of issues for first responders, say in this COVID-19 issue. So there's no one you're going to go to talk to after the experiences that you've had. So, but then they work amongst themselves. So you talk to your colleague, you speak to someone else who does the same kind of work that you do.
Actually chenye huwa tunafanya ama what we get, labda tukipata mgonjwa kama huyo ni gari peke yake. And you know ukipeleka mgonjwa hospitalini lazima uwe na pesa. So gari peke yake ndio huwa tunapata, MSF ambulance only. Hiyo tu ndio tunapata. So lazima umobilize people, watu wa kitu kidogo ndio tuweze kusaidia. Actually hatupati usaidizi mwingine huko nje. Yeah.
She says that it's also a big issue when it comes to like resource mobilization. Say if you need maybe an ambulance, you need to have gloves or anything else to help you work well, you don't get that. They have to come up amongst themselves, pull their resources, same thing, and organize that. Now and then, maybe they'll find a well-wisher to help them get an ambulance, but that's it. Otherwise, they are on their own.
Okay, thank you, Milkah and Lena. Dr. Flavia, any thoughts on like the supports for the people who are working as essential workers or community leaders in favelas and informal settlements?
Well, I'm going to add something to what Milkah said that is very important. Here in Brazil, I can give you an example of Paraisópolis, that is one favela in São Paulo, that they did inside the favela something that is very important, and they did for themselves because they do not have ambulances, as Dr. Milkah said. And what they did is to have like, for each part of the favela, they would have like a chief, we can say like that. They have a chief that was looking for everyone in that space, in that square. And as they don't have ambulances, they were looking to buy one. Can you imagine that? Like a favela needs to buy an ambulance for themselves, although they would not have something to let them go to a hospital or to anything else. Here in Rio, I didn't heard about something like that, but I heard about Paraisópolis that was doing that because they were afraid of what's going on, of how much people inside the favelas are going to be contaminated, and the COVID will spit out and would get increase more and more and more and more, and they don't have like a chance to call a hospital or the police or anything, or the fire workers or anyone to help them and send an ambulance inside the favela to help there. So they were thinking about buying an ambulance. So think that is something that you are completely, like, you don't have any help from anyone. You just have yourself. And this is terrible because these people, as I said before, they don't have even money to eat. And they are looking forward to buy an ambulance, although they will not get into the hospitals. So, and even though, knowing that, they also think that even getting into the hospital, they would not have places, like they won't have like a bed or something to get prepared for them, because their numbers are increasing. And also I gave some numbers at first. We know that numbers inside favelas are not that clear because they don't let us in to know exactly what's happening. This is something that is approximately what's happening inside favelas. But in my opinion, in my general opinion, I think that the numbers are much bigger than the ones that I gave to you. So it's terrible to think about that. And I think in society, it's getting worse for the ones that don't live in favelas, and for those who are living in favelas, it's terrible.
Thank you. Dr. Julia, anything you would like to add to that? You're muted.
Okay, they have said more or less that is at the end of post-COVID. I think one of the things we'll have to deal with is the burnout and the mental health also associated with the social work counselors and all that, because people have really given themselves to help others, but in terms of they are getting themselves, it's very limited. One, the organization I'm affiliated to, one of the things we do is to support community structures like pastors, religious leaders, and all that, equip them so that they are able to go and provide mental health services within their communities, and also provide psychosocial support to them. But again, this time is very tricky because of this social distancing. Yes, you can do online, but again, there is the challenge of finances that are required in order for you to buy bundles. I don't know if bundles, to buy airtime and all that. So even engaging them online becomes a challenge. So it's really, a multiple layer of issues.
So we have a couple of minutes before we open our Q&A session, and I wanted to ask you, what are you hoping for, or what are your demands during this COVID pandemic and the COVID phase in order to be better equipped to manage mental health? What are the things that you think are needed from not only the structural forces of politicians and government, but for the communities to be able to manage this crisis? So Milkah, could we start with you?
Come again, Yamile.
So could you tell us a little bit about how do you think we can help with mental health in the communities or through government? What needs to be done to help people?
Yeah.
And also to help the workers, the people who are working as well.
Yeah, to me, it will be wise if we could get the well-wishers to join together with my fellow social workers, come and try to make our people understand the virus is very dangerous and it is there for us to live with. Yeah, Lena, come again. Can you help me?
Sure. Anaulizia vile vitu ambavyo matarajio yako kwa address mambo ya mental health, ama vitu ambavyo unaona vinaweza vikafanywa ndio manage your mental health among its community na nyinyi wenyewe.
Hapo ndo nilikuwa najaribu kuelezea, ingekuwa ni vema kama tungepata the well wishers tukuwork nao pamoja, kwanza kuweza kuelezea na kueneza kabisa that the virus is there, na lazima tujue kukaa nayo, we comply vile tumeambiwa tuweze kujiweka kwenye usafi na nini. And also to us, tuna need a lot of counseling because tumepitia. Unajaribu unajua hapo earlier before tungeweza kumobilize watu, tunasaidiana nao pamoja using what the little we have, but for now hali vile imekuwa tu ni ngumu, people are jobless, and also me and others there, we are jobless. Inakuwa ni ngumu sana at sometimes tunaachilia wengine wanakufa because we have nothing. Na pia msaada mahali tunaweza tukakimbililia, hakuna mahali tunaweza tukaweza kukimbililia. So itakuwa ni muhimu na ni vema kama tungepata those counselors wakuje kule, tutafuta mahali at least kutakuwa na social distancing, tuweze kuongeleshwa na pia waweze kuongeleshwa na kuweza kuelezea the thing is there na lazima tuendelee na hii hali, and pia tukiomba Mungu because bila Mungu we can do nothing. Thank you.
I'd like to translate what she's just said.
Thank you.
She began by emphasizing the importance of sensitization during this period of time, that people still need to be reminded over and over again, because we do not know the length of time that we are going to be forced, or rather we have to live with this pandemic. So we need well-wishers, people to come train, help give support to the work that they do within the community to enable them perform well. And then she talks about counseling for them who work as community mobilizers, social workers within the community. She says that it's important for them to receive that counseling because times are so hard now and difficult. The kind of help they could get or even pool amongst themselves is no longer possible. It's become so difficult. And she's saying that there are times when they're actually forced to just look the other way and let other people die because they do not know what to do. They can't raise money at that time, so then that affects them definitely mentally. And she says, but most importantly, people should pray. Those that believe in prayer should trust and believe, and hopefully we will have an answer.
Yeah.
Yeah.
And adding on that, an addition on that, Pia, before
we're running out of time, so I'm just gonna go ahead and ask the question to our other panelists, but we'll come back for the Q&A, okay?
Okay, thank you.
Thank you. So Dr. Flavia, would you share a little bit of that with us? What do you think it's needed to be done?
Thank you, Professor. It's important to say that some symptoms that are coming with anxieties are also psychosomatics. So sometimes people are not only have anxieties, but they are thinking they have COVID-19 because they are having psychosomatic symptoms. So they start getting asphyxiated, or they cannot breathe, or they have some fever, and they start thinking immediately that they have COVID. And inside favelas, that gets worse because as long as they need to go out, they need to go to do like informal jobs or anything like that, they get in touch one to another. Or the favelas are very, they have small streets, small fields, so people can go inside and get outside, so it's difficult. The passages are very smaller. So thinking about that, what can be done is first to prepare more the CAPSs. The CAPSs are these little clinics that are inside the favelas. Prepare better with more professionals inside these CAPSs to help these people. Not imagine that one favela has one psychologist. That is impossible. Like if it was me, I couldn't help the whole favela all by myself. So saying that is important also to say that is important to prepare more the CAPSs inside the favelas, and also prepare more people around to work with these professionals of health, with medicals, with doctors, with all kinds of people that are working with health, to get in touch with these people that are helping people. People that are helping people, they also have symptoms, they also have problems, they are also afraid of getting in touch and getting COVID-19. So it's important to make them feel at least secure, at least they feel like they are well and they can be safe doing their jobs while they know the COVID is going on around the country, around the favelas. This is the most important issue at all. But as I said before, as it's something that I have on my project on Terapia para Todos, it's important to say that mental health must be a priority to all countries, to all communities, all over the world, and it's not. I'm very glad we have this conversation today to make it more clear for people that have at minimum of knowledge, at minimum of university studies, and to say that we must do something now, because we got to a point that like COVID is not, can end totally with a population. Yeah. This is crazy. This is difficult to say, you know, but this is crazy. Like, we are not helping each other, and we must do that. It's our job. That's why I got to university. I did my post-graduations. I worked with that. I did that because I want to help people, and I'm not able to help any more than I'm already doing, but I wish I could. but
you.
I'm only one.
Yeah.
Maybe people can think more about that. I'm sorry about the emotion.
No, it's fine. It's fine. And it shows how much work and how difficult this process is for everyone, and especially for the people who are trying to help others. So on behalf of our audience, I just want to take a minute and say thank you, because you're doing the important work that needs to be done. And we do have to put priority in mental health and in supporting the people who are working. I want to take a little bit of time to just bring some questions from the audience to our panelists. Dr. Julia, we have somebody who's asking if you and the people that are doing the work in the communities have the capacity to create services of mental health support groups in the communities, or bring some type of mental health intervention. Could you talk a little bit about if that is possible in any way?
Okay, I can do that. We are trying to bring some form of mental health in the community, that little we can. One of them, like in terms of the solution, this is related to what I see as solution and what we are doing, is to strengthen what I call community structures. For example, one of the things we are doing, like I had said earlier, is to work with religious leaders, community leaders, and all that. And these people first educate them about mental health. What is mental health is all about? Because like I said, there is a gap there. And then equip them with some skills in counseling. Because one of the things we said earlier is that mental health services are very limited. We have very few trained psychologists and psychiatrists and all that kind of thing. But when we have these community leaders and religious leaders, and we train them about mental health, then they go and they are able to work at the community level. Because, for example, the religious leaders, they have churches. People who go to their churches, they are also respected in their churches or in their communities. And therefore, they are able to reach a number of people within their community. But also another thing we are doing with the people we train, we also provide them with psychosocial support. We counsel with them because we know that they need that counseling. So that is one approach. And the second one which we are doing, I would like to emphasize, is what I'm calling the family support approach. Again, it goes back to the whole issue of education and telling the family that we need to be each other's support. Instead of fighting each other, instead of fighting children, because sometimes people are not even aware about the impact that is having on the children or on them. But again, it's educating, and one of the tools that has worked very well in this context is radio again. So we are trying to do even radio programs just to educate communities, especially in the informal sector, of how they can establish support system within themselves, the family support system. Because if as a family we decide to look at this issue, we are able to talk to each other and all that kind of thing, it provides that support we are talking about. So the community, strengthening the community structures and this family support system are very key. Right now. I can talk of those two.
Thank you, thank you. Dr. Pitella, we have a question for you. That you mentioned that the healthcare system in Brazil is a universal one, but in everyday practice, it's not like that. Could you tell us a little bit more about what is the discrepancy, that it's supposed to be universal and it's not?
Yeah, sure. Something that is important to say is that in the whole world, although I'm not talking about like rich countries, right? As I lived in Africa too, as I had my experiences outside Brazil, and I saw many stuff. And all that I saw is that it's not clear for people that mental health must be priority in their lives. People still think that therapy, that doing psychotherapy is something for crazy people or for those who have like any illnesses that are only for those who have like schizophrenia or some kind of autism or anything like that. And it's not. Mental health is for all. As I said before, as you said in your introduction, talking about me, as I think, as I believe, is that mental health is for everyone and must be accessible for all. And in Brazil, this is very, very, very taboo, because we don't talk about it. Talking about, for example, suicide or anything related to mental health is something that cannot be talked, cannot be an issue, cannot be said. Like some universities, like big universities, important universities that receive also students from outside, from Columbia, from Harvard, and many places to study here, to see what happens here. They also see that inside the universities, they have problems about suicides of students getting suicide. Like at this moment, we have also people thinking about suicide because of the COVID-19. And this is very dangerous. As I said before, anxiety is one issue, is a big problem, because everybody is having anxiety at this point. But also other kinds of troubles, other kinds of illnesses, mental illnesses are happening between this, like thinking about suicide, depression, and all kinds of mental health problems. And the real point is that Brazilian government think that if they have something very particularly or palliative, as we can say, to do in hospitals, they are already done what they must do. And it's not like that. It must be done much more. As I said before, people that are working with us, like doctors, like nurses, everyone must be taken care too. And people inside the favelas, they don't even have these. Can you imagine what a doctor or a nurse are having? This is difficult. Like inside my program, we assist also professionals of health in general, nurses, doctors, everyone. They are working inside the favelas. They are working in the little clinics inside the favelas. And they get crazy. I have one example to give. I have one patient that he's a doctor. He's a very good doctor. And he got like thinking about himself that he was unable to work in a place like that because he was crazy about getting COVID-19 and getting back home and spreading out the COVID-19 to his family. And what can you think about something like that? A doctor that cannot do his work properly, what can you think about the population that is being taking care about this doctor? He's afraid of working. He's afraid of going inside the favela. He's afraid of going back home. And this is making him not doing his job properly. Although he can pay for psychotherapy with me. He's the one that is not, he's not on the program because he's not the part of the program because he can pay for therapy. But I'm very happy because he has this conscience that he must prioritize his mental health. So it's difficult to say, you know, because it's not only people in favela, it's also the people that are inside the favela working with them, trying to work with them.
Thank you for that. Milkah, could you tell us a little bit about what do you think is the reason or the trigger for the mental health issues with COVID-19? Is it fear of catching the disease? Being able to feel abandoned by the state or the government or the organizations, the isolation? One of our audience members is asking, what are the reasons people are having mental health issues?
Again, I call upon you, Lena. Come. Just bear with me.
It's okay. She's asking, or rather there's someone from the audience who would like to know, wataka kujua vitu ambavyo, Yamile?
Yes.
Yeah.
Repeat again, please, so that I translate
Yes.
it well.
So the audience member is asking, do we know or have a sense of what exactly is causing mental health issues in the community? The social distancing, the fear of catching COVID, or feeling abandoned by the government and the organizations? Anything specific that it's a trigger?
Milkah, wanaulizia ambavyo hasa vimeleta mambo ya shida za afya za kiakili kwa community yenu kama kule Mathare. Kwa hii season ya COVID inaweza kuwa ni vile pengine watu hawawezi social distance, pengine serikali haijakuwa ikihusika na mambo yenu, ama ni shida za kutopata vitu ambavyo mnahitaji.
Ni shida ya kutokuwa na zile vitu ambavyo tunahitaji, like daily tutasema aje, kama chakula cha siku, without wewe kwenda kazini hutaweza kuwekelea kitu kwa meza ukule ama upatie watoto wako. You see now, those are the things zenye zinafanya watu wanakuwa mentally challenged. And also watu hawakuelewa na bado hawajaelewa na hawajajua na kabisa kuna those doubts whether the virus is there ama haiko. Wanaona ni kama wanafinyiliwa na gava, wanaambua hizi vitu ziko na labda hakuna. They feel like they are denied, as in they are like wanafinyiliwa na ile kitu ambaye haiko. Actually bado hawajajua kweli the thing is there, the virus is there. Bado kuna hiyo inawafanya wanakuliwa na kichwa, is the virus there ama haiko. Yeah.
Milkah puts across 2 points. The first thing she's saying is that what is making it worse in informal settlements, like where she lives right now, is the fact that people cannot even be able to provide a meal for their families. So the struggle of even being able to work and get food on the tables, that is one main cause of mental health issues there. The second thing she's saying is that some people don't believe that there's COVID-19, there's a pandemic. They feel like it's something that probably is being pushed at them and the government is trying to make money out of it. And there are so many conspiracy theories around that, the whole COVID-19 issue. So people are stressed. They're like, no, probably the government is looking for a way to oppress them some more. So people need information around that still.
Yeah.
And then to finish up, we had one more question that we want to share with you from the audience. Dr. Julia, maybe you can help us with this. What is the relationship in Kenya and with the government and the communities? Is there a relationship that they're assisting, they're present, or it's not existent? Oh, you're muted.
The government in Kenya has recognized that there is a relationship between COVID-19 and mental health. And they have tried to put a few things here and there, but not fully, not to the maximum, if I may use that word, as much as they acknowledge. They have tried to bring organizations together here and there who are involved in mental health activities to see what they can do together, but the efforts are still not being felt, if I may say that, because there's so many needs. There's a lot of need that whatever little is being done, it's hardly felt. And again, besides acknowledging that there is a relationship between COVID-19 and mental health, I don't think the government has set aside any resources to address the issue of mental health, especially at the community and the informal sector. So that relationship is there. It's not being prioritized as much as it's being discussed. So it's been left to individuals, NGOs, and all that kind of people to address the whole issue of mental health at the community level. Did I get the full question?
Yeah, perfect. Thank you. So I just want to take the last minutes to maybe each of you can take 1 minute or two to tell us what, in a conclusion of today's conversation, in terms of your feelings and moving forward and fighting this illness and this pandemic, but also mental health issues that have come with it. So why don't we start with you, Dr. Flavia?
Thank you, Professor. Thank you, Teresa. Thank you, Paulina. Thank you, David. Thank you, Dr. Julia. Thank you, Milkah. Thank you, Evelina. Thank you all for being with us here, because I think what we discussed today is something that is about the whole world. It's not about only our countries. It's not about only Brazil or Rio or anything like that, or Kenya and Nairobi and all that. It's more than that. We are discussing mental health. That is an issue for all countries around the world. And we know already that for this century, the whole problem is mental health. If we think that DSM is that we call a Bible of mental health, it began with 100 pages, and nowadays it has 1,000 pages. We can understand that mental health is becoming an issue and is turning to be the future of any of us, is becoming to turn in something that is not only psychosomatic problem, but also even in the future maybe something genetic. So it's important that we have these conversations like this at this moment of COVID and also in other moments, because it's important to tell people, to tell others that what we are doing, what we are at least trying to do is to conscientize the whole world how important is to take care about their population mental health. I'm very glad to be here, to be with my colleagues and to be with you guys, and I hope we have better days. That's what I can say. And whatever you need from Terapia para Todos and from me, I'm here for you. Thank you so much.
Thank you. Dr. Julia?
Okay, for me, well, my last words are, first, thank you so much to Columbia University and all the panelists. When I think about mental health in the light of COVID-19, I think of a deep river. Sometimes you don't know how deep a river is when we look at it from outside, especially when it's a narrow river, so to speak. You don't know how deep it is. And I think when I think about COVID-19 and mental health, I think of a very deep river, which we may not see right now, but the crack is so big. So this conversation, the conversation we have had today is very important, and I hope that those conversations will continue. But besides continuing, we'll see how different organizations can come together, they partner and look for joint efforts so that we don't run with different efforts. Because I believe that when we come together and look for solutions together, there is synergy, and that synergy will make this deep river not to go as deep, but it will start flowing, and the whole issue of mental health will start flowing, and we will start addressing them instead of them being stagnant. Because we can talk, but at the same time, we need this action to ask ourselves, how are we going to address them? So I'm so glad to be here and to meet everyone, and I hope that this conversation will continue. Thank you.
Thank you. Thank you. Milkah, would you share with us, what are your last thoughts?
Thank you so much. I'm much grateful. The platform to me was good, was a chance given for me at least to share what I've been going through, and I can tell you that I'm on a healing process. I know it shall be well. I would urge you to keep on praying to each other, and I know to together we can make it. I just want to wish my community well. I know it shall be well, all will be well. Things will get up to normal. And to me, I'm somehow emotionally touched. I'm affected. I need your prayers. Keep me in your prayer. Thank you.
Of course we will. And I think many of the audience members, Milkah and Dr. Julia, Dr. Flavia, were sharing how incredible it was to hear your stories and how thankful they are that you have shared them so openly. So just know that you have people behind you. And as Dr. Flavia said, this is a community. We're all trying to work towards the same goal of helping people and making things a little bit easier for everyone. So on behalf of them, we want to say thank you to you. And I just want to give the microphone to Teresa or Pauline to just share with you some closing remarks, and want to thank our panelists and especially also Lena for your support and your translation, and hoping that this is the beginning of a very important continuous conversation, as Dr. Julia said, to keep that river flowing. So great analogy, Dr. Julia. Thank you. Teresa, you're muted.
Thank you, everybody. Thank you, Dr. Yamile, for moderating this conversation, and for all our panelists. I think, just to reiterate what Dr. Yamile said, it's fascinating that we are talking Kenya and Brazil together on similar challenges. So we're very far from each other, but at the same time, our challenges are so similar. And mental health, I can say personally, as a person, not just as a professional, not just as the audience of your discussion, as a mother, as you know, as a woman, that it is definitely a priority we should consider. Definitely something that we need to focus on. Otherwise, I don't think we will have strength enough. And I thank all of you for your vulnerability, just like Dr. Milkah. And I'm invited to participate in further discussions. Sorry, I have a 5-year-old here just calling out, and I apologize for that. He was quiet throughout the whole meeting, and especially now when I'm talking, this happens. So this is the kind of patience and togetherness we need to learn by accessing mental health, good mental health, I guess, sane mental health. I had a lot of things that I wanted to share, but this is not the space or the time, or the time. I would invite everyone to keep this conversation through our channels, the Columbia Global Center's channels, and invite our speakers to also be accessible and come back to us so we can further this discussion with the School of Social Work and the Columbia Global Centers in Nairobi and in Rio, being led by Dr. Murugi and Dr. Tom Trebat. So thank you all for the opportunity. I'll finish here because I lost my train of thought, but it's wonderful to see everybody, and I do thank you all for this. Dr. Yamile?
Thank you, and we just want to reiterate, it's a community, it's a continuous conversation, and hopefully this will be the beginning of more support towards one another. If something came out of this, aside from the important work that is being done, is that, as you said, Teresa, we're all going through a difficult time, and community and helping each other is extremely important. So let's just have that in mind. And with that, we want to thank you, and hopefully we'll see you in the next panel next Monday. Same time, 11 Brazil, 10 New York, 5 Nairobi. So thank you for joining us, and have a great week. And remember to always take care of yourselves and others.
Thanks, everybody.
Thank you.